I have the great pleasure now of being joined by APHA President, Dr. Lisa Carlson.
Thank you so much. I'm so happy to be here.
Tell us about your year as president during this public health crisis we find ourselves in.
Yeah, wow. I mean, what a year to serve as APHA president. I knew that this would be the most tremendous honor of my career before we had the greatest public health challenge in a century. So really, it's been quite a year to do this. The job is really different than I expected. Generally, what our APHA presidents do is travel the country and visit our affiliates and be part of their annual meetings. I had a lot of those trips scheduled for the spring, and not surprisingly, they were canceled. So there was a little bit of a lull there, trying to sort of figure out how we'd regroup. I spent a lot of time doing press interviews and virtual interviews. And then our affiliates really regrouped and are a lot of them having fall virtual meetings. So in some ways, much of my presidential year is happening right now. I'm talking to a number of our affiliates in October and November. And to me, that's really emblematic of 2020 as a whole. I mean, we haven't yet had the time yet to pause and reflect on the year because we're still living through it anew every day. And I feel a little bit like that's what the presidential year is like. I'm having sort of a rush of the year all right here at the end.
Can you talk a little bit about how public health experts and the APHA have been sounding an alarm about the social determinants of health well before COVID-19 even hit?
Yeah, I think it's important to remember that public health was not naive before COVID. We knew that social determinants impact health. We knew that Americans had pre-existing conditions, that they had little to no savings, that they don't have a national paid sick leave. And we have a society at risk. We're really fueled by social structures like income inequality or the coupling of health insurance with employment, structural racism. I mean, we've been sounding the alarm that we know the fact is inequity kills. And so APHA has been really active in sounding that alarm long before the pandemic. And I think these issues have really only been laid bare by the pandemic and magnified in such a way that those realities are much harder to ignore.
I understand you've been encouraging people to spend more time outdoors. Tell us a little about that.
Yeah, I do. I think one of the inequities I care a lot is about inequity in green space. And it's another one of the things that really became apparent in the pandemic. So early in the pandemic, when we locked down and we told people to stay safely indoors, but to get safely outdoors, it became apparent quite quickly that not everybody has access to safe green space near their homes. And so some cities, they closed their streets. And so they gave people a safe place to get outside and keep their physical distance from each other. And really applaud that kind of thing because we know that people are more likely to report good health and well-being if they spend 120 minutes a week in nature, which doesn't sound like a lot. But people spend about 90% of their time indoors, and that was before the isolation caused by the pandemic. So I think that right now, nature is really a place where we can get respite and get out into the trees to restore our spirit and be part of that sort of physical and mental health exercises that we need to keep us mentally and physically healthy.
Mental health has been a huge issue in this pandemic. It's also a huge part of your message. Talk about it.
Yeah, I was talking last year about what I wanted to think about when I was out in our affiliates this year, and I knew I wanted to talk a lot about mental health being essential to public health. And that was before the pandemic. So if you think about it, in an average year, 1 in 5 US adults struggles with poor mental health, which means that most of us know somebody who has struggled. But I think you could argue that in the pandemic, everyone knows someone who's struggling if they aren't struggling themselves. And so this is really a particularly critical time to acknowledge the impact of mental health when talking about COVID-19. So every time we talk about COVID-19, every time we talk about public health, we should talk about mental health. And I also want to acknowledge that public health workers themselves are struggling right now. This is, as I said, the greatest public health crisis in a century. And so I want to encourage people to take care of themselves and take care of each other. And we can do that with simple things on our own, like going back to the basics, getting plenty of sleep, getting plenty of rest, eating well, making sure we get outside and get a fair amount of exercise. And all those things are important, but we also want to take care of each other. And I mean that both in terms of you and your colleagues asking if people are okay, if they need to take a break, but also sort of writ large in how we think about promoting mental health and being part of those conversations. I think public health is the right group to convene conversations about mental health, to have those cross-sector discussions.
What do you see for APHA moving forward, and what tips do you have for the incoming president as we continue to move through this pandemic?
Yeah, I think the most important thing I want to say about where we are and where we're going right now is thank you. I think that the public health workers who are on the front lines right now, who are fighting the good fight of public health, I think probably aren't hearing enough thank you. And so I want to just say APHA is here to support you and to advocate for you. I think our greatest strength is in our membership numbers that we bring to bear when we advocate with legislators. And there has never been a more important time to be part of that movement. In a whole generation, there hasn't been a more important time than right now.